Welcome to In the House. I'm Mark Shiver, and so glad to have Representative Frank Sossamon with me, District 32, Granville and Vance counties. Representative Sossamon, welcome to In the House.
Good morning. Good to be here. Thank you for the opportunity.
Well, I won't tell everybody about the big blunder I made the first time we tried this, but I'm glad to have you and appreciate your patience and your graciousness with my humanity making a big mistake. But anyway, we'll move on from that. And I'm excited to talk to you because you've got several things that are really, I think, very interesting. Number one, you said that you had been getting calls from some other media about the child care situation that's going on in North Carolina. A lot of them have closed. We've been seeing those news headlines. Tell us about your thoughts about what's going on there and how important that is.
Well, I have two forums coming up that highlight childcare, and the reason being we're in such a dire strait with childcare. The North Carolina is known as the desert, childcare desert. 4% of our daycares across the state closed. We have some on the verge of closing due to the loss of funding. Federal funding that came in during COVID is no longer going to be there after June. So daycares are scrambling to try to figure out what they can do to survive. So that affects every community economically, because one of the criteria that industry looks at when they come to an area is not just education and crime and recreation and those type things. They also look at childcare because they want their employees to have good, adequate, quality childcare. And if they don't have childcare, then they'll look in another direction. So there's two parts of my forums to address that. One is to reach out to all businesses, churches, and entrepreneurs at 1 o'clock to talk to them, make presentations to them about how to start a child care center and the benefits, like for an employer. If an employer has a child care center on property, they will increase the morale of their employees because the child is close to the parent and they can see them throughout the day. If they're sick, they can still usually bring them to work unless they have something contagious, and they can monitor them and watch them. So there's a lot of pluses for an employee and for the employer too. Churches can look at it as an extension of their ministry. And that's what I'm hoping to do in making the sale for them to consider starting childcare centers. Another thing about a church, there are people in the church that would not work at your daycare, but if the church started a childcare center and it was a part of the ministry and they bought into that, they would come out of retirement to work either full-time or part-time to be a part of the ministry for their church. So I'm hoping that we will get some traction. We've already had a couple churches a call that have an interest. Walmart, one of the large employers in the area, they've already called us and told us they were going to be there because they realize the importance. But we'll have the state DHHS child care department there represented. We'll have Smart Start. We'll have the community college. We'll have Chamber of Commerce of both counties there. We'll have a lot of other entities there that will help them understand you have resources and you have support. We're here to make you aware of that. You start that child care center, we're here with you. And in the evening at 6, it's a public forum. And we really hope to educate the public about the importance of child care. And it's not just babysitting, it's developing your child socially, emotionally, intellectually, physically, on down the list. So they'll be prepared when they go through your child care center, they'll be prepared to go to kindergarten. So it's critical, and it's critical across the state.
We, church that my wife and I attended for years and years, they opened a child care back in the day. And one of the things, another added sort of benefit was people that didn't go to the church would come to that childcare and, drop their kids off or whatever. And we would have people join the church
Right.
because their children were going to that childcare. They would see how nice people were, and they would see the facilities. And so it's a way to attract new members also.
Yeah, it's an outreach. It's an outreach.
Yeah, absolutely. And the need for childcare is definitely growing in North Carolina. Something that I know people are glad that you'll be addressing in your district. The other thing that seems to be just a huge need that needs practical solutions is mental health. And I think you've got an idea, a bill that you're working on, a pilot bill. Tell us about that, because I'm real excited about it.
Well, this came out of mental health forums. We've had mental health forums in both counties, and it was so popular because of the need that I've had churches to say we want to host a mental health forum. So we've had additional forums. It wasn't intended, but because of the need. Well, out of the putting together those forums, working with all the agencies and all the providers, from a pastoral background, that helped me with daycare, because I have had a daycare at the church I pastored for 36 years. But I realized that we can't hire enough mental health providers. We can't hire enough. We can't hire enough individuals that work in the field of mental health. So I thought, what would happen if the church would be equipped to be able to meet some to a certain level of the mental health needs and crisis? So out of that, and talking to Department of Health and Human Services Mental Health Division, the local health department via the mental health provider, other groups and agencies, some of them private, some of them public, some of them nonprofit, I floated the idea of a mental health certification for churches. And they just said, that's wonderful. Tell me more. What are you thinking? Well, I did. And out of that, we developed a mental health certification for churches. And there's 3 levels. I felt like, from a pastor's viewpoint, that if there was only one level of certification, some churches and pastors and leaders would say, that's too much. We're a small church. We can't do that.
Right.
We have 3 levels, and on those 3 levels, any church could participate in the mental health certification. For example, I'll just mention level 1. Level 1, the church goes through an orientation. The leadership goes through an orientation to become acquainted with all the providers in their county. They know the names, they know the services they provide, they know the phone number, they have the address, they have some names of individuals that are employed there. So when they get through with that orientation, they're well equipped to give direction. Now, they're not therapists, they just give direction. For example, if a pastor talks to Bill in his church, and he sees the signs of depression, is clear. And he says, Bill, it's obvious from what I'm seeing that you're depressed. And he will, and let's say he agrees. Bill, this is the agency that you need to go to, and they can help you with your depression. That's one of the expertise they have. Well, I am suggesting that rather than just give Bill the information and send him on his way, that the pastor or the church leader that's been through the orientation will say, Bill, if you'll give me permission, I'll call this agency and we'll set up an appointment right here, if that's fine. Well, if he agrees and you make the call, you set up the appointment, you write down what it is so he can take it with him. Let's say Bill doesn't make the appointment. That agency is going to call Bill. Bill, we missed you at your appointment. Is there something that we can help you with? He said, to be honest, I don't have transportation. Well, we can provide that for you. So
Yeah.
now Bill doesn't get lost or falls through the cracks. He can get the services that he needs. And let's say Bill is really in a crisis. There's a mobile crisis unit that church could call, and they would come to the site and they would see Bill and give Bill the services that he needs too. So the church could not do that had they not been equipped. The second thing that church agrees to do is to highlight a mental health issue each month. We just mentioned depression. Let's say they are highlighting depression that month. We'll provide materials that will better educate the membership of that church on the topic of depression. And then out of that, we're encouraging, not mandating, we're encouraging the pastor to consider, if he's doing a series or she's doing a series, to step out of that series and to preach on depression. And if they're doing Bible study, to step out of whatever their study is that Wednesday night, and let's talk about depression. Let's talk about the signs of depression. Let's talk about what can be done to help a person that's in depression, et cetera, et cetera. So anyway, all of that's there. Now, that sermon and that discussion on Wednesday night is doing something that is unseen, but is still happening. It's demystifying mental health.
Right.
All of a sudden, it's pulling the curtain back and saying to the church family, it's all right to talk about mental health. And that's liberating for people who have been hiding their mental illness, but now they feel comfortable in talking about it in their church. That in itself can help a person cope with their mental illness. I'm not saying that by itself, they still need other attention, but that in itself, when a person can talk to another person, getting things off your shoulders can help you tremendously. So in those levels, there are more and more that a church can do. Like the third level, mental health first aid training, which is 8 hours, a little more intensive, but we're excited. I had previews, Mark, with Granville County pastors, and I've had a preview with Vance County pastors to go over the certification, and they were just thrilled about it. They said, we need something like this to help us so we can help our congregation and help those in our community.
Yeah.
So they're on board, and we're looking for it to go well. We're going to be running a pilot bill in the short session, and it looks very promising. And I'm already positioned. Once it gets through the House and the Senate, I'm positioned to go ahead and kick it off here in Vance and Granville counties, and study it, look at it, review it, and I'm hoping the next step will be to make it statewide.
Well, I think that's a fantastic idea that you have, Representative Sossamon. I think the key thing that you said there is that people feel all by themselves. They feel all alone when they're fighting depression and mental health issues. And so this opens the door to communication, which can only help. At least we think that it can only help. And so I think that's a very good thing. Very good. I hope that it's something that'll make it through the legislature, because it's practical. And
Yeah,
like you said, the mental health, it will never have enough money to address
no,
everything that needs addressing. And so this is using something that's in place already to do good work. So I think that's fantastic. Another bill that you have been working on, which is practical, meeting a need, is called Shine Like Hailey, the parade bill. And poor Hailey Brooks, we remember, was tragically struck by a vehicle in the Raleigh Christmas parade a while back. And this bill would put in place, it's already passed the House, I believe, it's in the Senate, but put in place some practical safeguards. Hopefully they'll prevent this from happening. Tell us about the Shine Like Hailey parade bill.
yeah. Senator Bodie and Representative Winslow are working on this bill with me. The bill is practical, and it is all about safety. and considering things that people don't always consider. And if they do consider it, it's not checked. For example, is every vehicle licensed that's in a parade? Has that vehicle been inspected by the inspectors in areas for cars to give them their ability to have their license, their tag? What kind of condition is that vehicle in, even if it's been through that process? So having somebody to check, make sure the tail lights work, make sure the brakes work, just a simple check, and it wouldn't take long, but it gives you a sense of security and safety with those vehicles being in the parade. So even though it didn't go through the Senate yet, we're hoping it will this short session. It went through the House unanimously. We're hoping that it will, but the bill still had a lot of benefit, because if you will look across the state, there were municipalities that implemented some of the things that we have in the bill.
Yeah.
And we're hoping that will become law. Again, we don't have any opposition from any groups because it's so practical and it's common sense and it's needed. So we're excited about it. It honors the name of Hailey, a beautiful, beautiful young girl.
Yeah.
That tragically lost her life. And listen, that could have been prevented with just these things we're talking about in this bill.
Yeah. Well, I hope it passes also. As we wind down here, just got a couple of minutes left. You've been having forums in your district, and it sounds like you really are trying to relate to the people that you have been elected to represent, trying to hear what they have to say. I know that you told me that you've had forums about broadband and transportation and mental health, human trafficking. And one thing I wanted to ask you, I had Representative Zinger on last time, and I asked him, what are people talking about in your district? And most of the time, it's usually a state issue that gets people going and calling and emailing. He said his email was blowing up over the topic of immigration, which normally you think is in the purview of our federal representatives. Mm-hmm. What are people asking you about? And it may not be immigration. I'm not trying to get you to say that, but what's on the minds of the people in Granville and Vance County as you approach the short session? You feel like you need to keep at the front of your mind to represent your folks.
Well, inflation certainly is a hot topic, and it is a topic that many people, when they talk to me about it or send emails or call the office, they are very perplexed over it. They're troubled over it because it is a real problem. And some of them are really wrestling with their budget. How can we survive? How can we eat? How can we pay for our medicine? When everything costs more, you almost have to take a loan out just to fill your car with gas. So inflation is one of those things. And immigration is one of those things too. People are becoming extremely concerned about the influx of unvetted individuals in our country. We're open to immigration,
yeah, but
legal immigration,
right?
And we can, as a government, we cannot continue to sustain what we're expending and spending for this problem.
Yeah,
it's a simple solution. Just honor our laws that are on the books, and that would solve the problem. But those are certainly two areas of great concern. People are concerned about education. They want to make sure that education is funded. They want to make sure that their children and grandchildren are receiving a quality education. Wherever that may be, they want them to receive a quality education. And I've been in and out of the schools and doing all I can to make schools visible, celebrate successes of schools. we have a Go Grant program, Go Outside, that teachers can apply for. It may be a field trip of some type, going to the zoo or going to see the battleship or any number of other things. It could be building a barn for some animals that you have at the school. So I've been presenting those Go Grants to teachers. I make sure I make it a big deal, because it is a big deal.
It is a big deal.
Sure I get a certificate, I sign that certificate, I frame it, I pay for that out of my pocket because it's a big deal. I take it to the school, we have photo ops, and then I make sure that we get that to the paper. And so the teacher can begin to talk in the article about the process she went through to fill it out. So now you're talking about initiative. She took the time, or he took the time to fill it out. You talk about the trip and what it's going to do, the experience the kids are going to have. You go on down the list, and it lifts that school up. It lifts that teacher, that educator up. So it gives them, again, much needed press, positive press. So anything I can do to help them with that, I am always on board, because I'm a supporter of education.
Well, Representative Sossamon, it sounds like if it's practical, it's on your mind. It sounds like you're trying to really do things that make a difference. I appreciate you coming on In the House, being our guest, and look forward to having you on again real soon.
Thank you so much, Mark. Great to be with you.
All right.